Good afternoon, everyone. I hope you're enjoying the day as much as I am. My name is William Miller. I'm from University of Massachusetts Amherst Extension, and it is my pleasure to introduce the keynote for our Community Connections track, Dr. Darrin Anderson. Dr. Anderson has over 22 years of experience in nonprofit executive leadership. He is a published scholar, frequent speaker, and recognized expert in equity-centered best practices, social determinants of health, and collective impact. In 2009, he joined the New Jersey YMCA State Alliance, and that's a statewide nonprofit organization that works with a coalition of 31 independent YMCAs at 78 program sites and over 400 licensed school-age and early childhood centers that serve over 1 million New Jersey residents annually. He became the organization's chief executive officer in 2018. Before joining the Y, he held leadership positions with the American Diabetes Association and the American Heart Association. He is an adjunct faculty member at Rowan University, Richard Stockton University, and Springfield College. Dr. Anderson earned his PhD in kinesiology and applied exercise physiology from Temple University, and his master's and bachelor's degrees from the University of Delaware in exercise science, cardiopulmonary rehabilitation, health and physical education studies, and biological sciences. Dr. Darrin Anderson.
I will apologize now. I have been dealing with, I have a slight cyst on my vocal cord. My ENT has told me to, I don't know if I need to hold this microphone or is it a little bit better? Okay. She told me to take voice rest, rest for a couple of weeks. So I try to go into my basement and rest, but I have a wife and a daughter that for some reason that does not like dad to take naps during the day. Or when I'm watching a basketball game, something goes wrong or the light bulb went out. Something's wrong with the TV. There's always something that's happening. But so I apologize now, but I will get a little excited, and sometimes clarity will be able to come through, and other times I may sound a little muffled. Also, another disclaimer, I am born and bred in Texas, Fort Worth, Texas. So I have maybe a slight accent. Those I've been working with in New Jersey have become accustomed to me. But if you're not accustomed to me, you have a colleague that's probably from Maryland or lower, below the Macy-Dixon line, you may just have to tap their shoulder and just ask them, what did you just say? And perhaps they can interpret for you. Whose first conference is this since COVID really just shut down our entire country? Well, welcome back out, and I hope you remember your socialization skills, using the words excuse me and pardon me, and actually opening up the door for others. By the way, you are in New Jersey, so if you decide not to do any of those things, you'll fit maybe right into the culture. But I'm sorry, that was a shot at my colleagues from New Jersey. I apologize but I've been working in New Jersey for 14 years, so I'm still waiting for a key to any city. Started my career working in Newark, New Brunswick, Trenton, Camden, and Vineland. Do we have any of our colleagues from any of those cities with part of cooperative extension? So some of your faces are familiar. I see Kara there and Jen. Jen actually interned with me years ago. So I just went ahead and said that. So if this is not a good keynote presentation, you can blame Jen, because she did not inspire me like 10 years ago. But I am here just to speak to you for a short period of time to really just talk about community connections and talk about innovation and what's happening at the community level. I think we all recognize and understand that COVID and its grips have really just flipped our communities upside down. What COVID has done has not only exacerbated, but has simply revealed some of the things that all of us knew that already existed. And the problem with COVID is that, we're still in the midst of this pandemic. And I think now some of our colleagues and researchers and infectious disease docs are calling this a kind of an endemic, because we're going to have to learn how to live with it. But learning how to live with it does not absolve us from the obligation that we have to the people that we serve and the communities that we serve. We should be a source of inspiration. We should be a source of information, factual information, maybe literature, objective data, but we also should have relationships where people will want to come to us. Many of you are going to be serving, if not, you're serving in marginalized, underrepresented communities where there are a large population of black and brown. Some of you are going to be working in communities with disabilities, and others are going to be working in communities that you're unfamiliar with. And so just a little bit of advice. If you're working in a community that you don't have a lot of familiarity with, do the research. And what I mean by doing the research, I understand that we have the SHAD and we have the BRFIS and we have the PEDNES and we have all of this surveillance and data that's available to us. But the problem with that information and that data, many times it's only given to us at the county level, like the county health rankings. Or maybe it's given to us at a state level. But when we look at the data from a county perspective, the county may look like it's doing very well, like Camden County. But if you break it down into Camden City, the stats are dismal. What's happening to our families and our kids and what COVID has done is not only reap havoc, but it has set us back another 15 years. Diabetes is back on the rise. Those that have diabetes and those that are at risk. Cancer screenings, people not getting those. Stroke and cardiovascular screenings, getting their medication. All of these problems are existing in our communities. So how do we stay connected? I'm going to advance these slides. Now make sure you let me know how much time I got, because I want to make sure I stay within the time frame, but also I want to make sure that I'm giving you your money's worth. Some of you flew from all across the country. West Coast? Some coming. I went to college 1 year at the University of San Francisco. Go Dons. So if anybody familiar with San Francisco area and Richmond, you can just wave your hand in the air. So let's talk about community innovation. So I stole this definition, but I cited the source at the bottom of the slides. Community innovation is a community championed change with benefits that are meaningful to the community. What makes community innovation different from other forms of social innovation is the focus on community. Placing community members as both the champions, and I added my own word, scholars, as the arbiters of change. So community innovation is about community champion change with benefits that are meaningful to the community. I think we need to take a minute to focus on the benefits that is meaningful to the community. There are many benefits that we can bring to the table as professionals or as individuals that had just received a large grant. But what happens is many times we come into these communities, we get a $5 million grant, we pull together a coalition, and we leave that community high and dry, and there's no damn benefit there. The only benefit is those PIs and those individuals like myself with these credentials that get a little bit more towards our salary. We get good benefits, and we're waiting for the next grant so we can come and do the same damn thing. There has to become a point where that has to stop. Because we're not going to engage the community in an authentic way, engage in community for those that have lived experience, and treat them like the scholars that they are, then stay the hell out of that community. I'm sorry, I'm getting a little fired up regarding this. Because every time someone receives a large grant, and let's talk about Camden City, there's so many times that we've we've done this H&P, this history and physical of the community. We know exactly what some of the plagues may be. We say we're going to bring this fix, but this fix is not something that is temporary. It has to be a long haul. It has to be chronic. It has to be there for a period of time. And I don't know if many of us have the patience to be able to do so, but that's what success is: policy, system, and environment change. Something that has sustainability and that can stay around. So the community benefit is a benefit that the community can feel for not only at that point of time, but for much more time to come. Innovation versus innovator. How many of you would say that you're an innovator? Let's be honest. How many would say that you're creative? So some of you, oh, this is much better. Some of you say that you're creative versus, and then creativity is a little bit different than innovativeness. So I work with a team of, it's almost 14 of us. We have 3 consultants, and I have one of my team members here with me today, Jackie. And Jackie and Marissa and Julia, that's part of our state initiative, Health Equity, they're very creative. In some regards, they're very innovative. But I'm sure that they think that I'm a little bit more risk averse. Like we started a farmer's market years ago, and one of our team members came and said, hey, You know what would be a great idea if we had a petting zoo here at the farmers market? Now, I don't know about you, but I don't want a baboon's ass right next to my watermelon. But now that was my being risk averse. But then when I have an opportunity to take a step back, rather than saying nah, nay, I needed to open up my horizons, my thinking, okay, let's talk more. Even though she went on to explain to us that this is a great idea, she still couldn't sell me on it. We never did bring that petting zoo, but we had one hell of a farmers market that benefited the community of Trenton. But when we talk about innovation and innovation versus innovator, number one, innovation is a competency. We have to build our competency. Many of you are very good at many different things, and it becomes innate. But in order to be innovative, some of us have to work at it. Some of us have to be intentional about it. Just like you're building a competency to community engagement. It's a competency. Now everyone has the ability to go into a community, go into a boardroom, and go into a corporation and begin to communicate and to blend in with the culture immediately. It takes time. Innovation is a competency. It is not something that should be on the back burner. You should bring that to the table with you. Number two, innovative leadership. What innovative leadership is about is not doing the traditional. You know, we decide we're going to pull together a coalition. We ask a few people, bring people to the meeting. We have that very first meeting. We hire a coordinator. We do all those things that we need to do. And then lastly, we think about, well, who else should we be connected with? That's from the community. What I would say is that we're going to be bringing resources to the community. Why don't we find a connector, the salesperson, and a maven? Let's find them first. Have a conversation with them and then allow them to send out the invites. And in fact, they should invite you back to the meeting, because they don't invite you back to the meeting as the PR. Perhaps that's not the community where you need to be at. See, if we do things the same way, we're going to keep getting the same result. That's called a definition of insanity, right? So let's flip the script. Let's start allowing our communities to lead this conversation, recognizing they may need our credentials, they may need our understanding, but best believe me, they're probably the smartest person in the room. My grandmother had a 6th grade education, but every time I had a conversation with her, she was the smartest person in the room. She had what she called good sense, not common sense or book sense. She said she had good sense. So we're going to have good sense. Let's flip up the paradigm, and let's make sure that we start with those that live in the community and allow them to invite us in, even if we've already have secured the resources. And then lastly, we have, can I see this here? Empathy and empowerment. Becoming an empathetic leader and empowerment means this, is that you value learning over knowing. You value learning over knowing. Most of the time when you come into our communities doing work, people really don't care about what you know. They care about how you make them feel. And are you an empathetic listener? You know, the problem with you know, sometimes people ask you how you're doing today, and you're like, fine. Well, you say, well, you know, I really have some complaints, but nobody is willing to listen. Well, if community have some complaints, we have to be willing to listen, because in that complaining is data and information that we can be using to create the arsenal that we need to move that community health and outcomes forward. When you go to the, and by the way, when you come into one of the communities and you're unfamiliar with it, there may be some things said. It's not directed to you. But if you're representing an organization, hello, I work for the YMCA. In their communities I go into, I've gotten tomatoes thrown at me. You closed our YMCA. I take that on the chin. I want to understand what the anger and what the frustration and what the root causes of that is, because there was quality child care that was there. It was aquatics program that was there. There was a recidivism program was there. And all of that's been taken away because some leader did not have the gauze sometimes to make the right decision. So I understand those frustrations, and you have to be ready to get your epinephrine pen ready, because you may get stung by some bees, but that's okay, you'll heal. Put some Band-Aids and some alcohol on it like we do down south, and have that resilience and get ready to go back. So, sorry about this. I'm so used to looking at my slides a different way. So what is the enemy to community innovation? Status quo. Status quo is our enemy to innovation because we want to do things the same way. Why is that? Because we're very comfortable with that. I have some very spiffy shoes I was going to wear for y'all today. Some really spiffy shoes, but I had one of my buddies told me they look like bowling shoes. I said, bowling shoes? I let him talk me out of wearing them spiffy shoes today, and I didn't get a chance to bless y'all with my nice tennis shoes that I had. So I went back to my status quo because I allowed somebody to take away my innovative spirit that I had. Status quo is the enemy, remember that. I got 5 minutes, so let me share a couple other slides and we'll keep it moving. Community change. So, how we're going to move the community. People say let's think outside of the box. Nope. With the community, we got to think inside of the box. See, we used to play a game when I was a kid called hopscotch. Some of y'all may have played it before. Some of y'all don't even. Who remember hopscotch? Let me see a show you. All righty. Now, y'all act like y'all not 45 years or older in here. Y'all can pretend that y'all young folks. And when you played hopscotch, you're supposed to jump and hop and scotch. But your foot couldn't step on that line. Why? Because there was value in that box. So anytime we're working in a community that is defined by either a radius or defined by a culture, the textbook definition of community has to be changed because we have to be able to understand that. Because in some communities, we don't have a community. I have my next door neighbor. 2 of them, I do talk to them, but one across the street, maybe once a year. But I have family in Texas I talk to every day because of these cell phones. So when we talk about in the box, we need to find community-centered solutions from the people that live and reside in that community. Live the experience, love the experience. So we got to think inside of the box. And quickly, this is just some data that I'm sharing. This is some data that comes from the County Health Rankings. This is a partnership with the Robert Wood Johnson Foundation and the Institute for Population Health in Wisconsin. This is living wage among U.S. counties relative to median wage. So the darker it is, the worse that it is. It doesn't seem that bad, but it's still dark enough. In certain counties, in most counties, we need to increase salaries by 73% just to give them up to living wage. We can do all the hard work that we're doing, but we're sending all of those people that we're trying to teach how to eat healthy. We're trying to understand what carbs and physical activity, and we send them right back to a toxic environment that's forcing them to live way beyond their means. So I know Martin Luther King, before he was assassinated, was starting his wage against poverty. And we need to really take a good look at this in the work that we do. This is also some additional data regarding child care. Same thing. We talk about we have food deserts, we have child care deserts. And the darker the area is, however, the worse it is. But guess what? If we were to adjust this data at the city level, at the community level, probably looks much worse. The discrepancy in New Jersey, our white colleagues are able to get their hands on about $312,000 worth of wealth. African Americans get their hand on about $5,000 worth of wealth. That wealth gap is significant, and we wonder why we see the same outcomes and the same challenges from year and year. And here's some other data. I just want to quickly show you here at the very bottom. Based on the federal minimum wage, you can see you can almost 93% of your salary can go towards child care if you're at the federal minimum wage. But if you're a married couple with about $100,000 in salary, it's about 14%. Now, I'm not here to encourage you to go get married. I've been married for 22 years. It's a bliss in some regards. I told my wife the other day, I said, I'm the best husband you ever had. I don't care how much you complain about me. And this should remind me I'm the only husband that she ever had. But this is real. This is real data. Child care and poverty is 2 of the main reasons that the social determinants of health continue to produce poor health outcomes in our country. And we need to think inside of the box on how we're going to resolve it. And when you come to my breakout session, Jack and I are going to share some things that we're doing. I'm going to share some innovative things we're doing from an employment perspective at the YMCA to make sure that we're getting our child care workers salaries increased and giving them free health care. Child care as well as health care. And last but not least, and I'll share this, there's 2 other slides. Community health workers. We do not take advantage of community health workers very well at the level that we should take care. There's a video attached to this, but I apologize, Angela, I'm not sure if the video works. But essentially what it's saying is Ethiopia had a major problem with maternal child infant mortality. by employing what they call community extension workers. Within about 5 years, they improved that by 25%. And the problem is, we saw it in COVID, is that soon as our finances began to tighten, the first people that were let go was community health workers. And those are the very people that we needed to continue to direct resources and opportunities towards those that was being plagued by COVID at a level that has never been seen before. But you can see those bullet points on there. And let me just cover one more slide, and then we can have time for a few questions. So there was a movie that came out called Pay It Forward. Many of you have seen it, where this young kid was doing such marvelous things in the community. Unfortunately, tragically, kind of lost his life. But then they started this passing things forward, this momentum. When we talk about what's happening in our communities, if we begin to band together to say that if something happens in this community, it's happening in our community. I just received a phone call from our CEO from the YMCA that has Buffalo in their service area. And he sent a letter out to all the members, sent a letter out to the police, out to the community about the tragic domestic terrorism that took place there. And what he's trying to encourage is for all of us to get engaged, to get involved. Because if we do not begin to advocate for communities or issues that are not our own, those issues that we think that's happening down the street is going to find themselves in our backyard. So we have to get to this mentality, this mindset about paying it forward. And I'm just going to conclude with this quick little story. This is a little girl that saw the trash guy. That's what she called him, the trash man. Here's the trash man that's coming down the street every single day. And she will look out her window. She says, uh-oh. She look at her clock and says, here he comes. Here comes the trash man. And she would just look out the window because she loved the way that, not the way the trash smelled, but the way that the trash truck looked. And then she said, you know what? She ventured outside of her front door. And then the trash man began to see this 3-year-old girl every single week at the same time outside on her step looking at him and the trash. So he began to wave at her. He started the shenanigans. And then the following week, this little girl came outside with a cupcake and said that she was no longer interested in the trash truck. She was interested in the trash man or a sanitation worker. It depends on the terminology that we use. And so from there began a relationship that every week he would drive through, and every week she would have a different snack. Now, if you think about the way that this young girl just engaged somebody that's coming into our community in such a positive light, there's not a reason why all of us cannot walk around with some type of token of appreciation that we can share to other community members. Your time is yours, and I can answer any questions that you may have. You're very good at that, too, I'll tell you what. You're prompt. I don't know if there's any questions, but I know we have a couple of breakout sessions. Any? All righty. Do I turn it back over to Ben? Oh, you do have a question? Okay.
Could you maybe talk a little bit about how some of these lessons relate to your work with the YMCA and how they informed you, that were to inform some of your views?
Well, the YMCA is for healthy living, social responsibility, and youth development. And in many regards, people see YMCAs not as a nonprofit or a charity, but they've seen us as what we call swim and gym. I can go in there and work out, and I can have aquatics. That's not what the YMCA is. That's never been our foundation. We are a community and human services organization. And that became abundantly clear once COVID hit, when our facilities were repurposed for COVID testing. And we provided food access and was giving out meals. In fact, you'll hear a lot about that because Jackie spearheaded much of that work across the state, close to 2.5 million meals. But we also did other things. So people have to understand the YMCA is just not about bricks and mortar. This is about meeting societal needs in our communities and doing it in a way that shows purpose, that shows benefit to the community. And I ask my colleagues this all the time. Look, if you're a YMCA, we have over 800 YMCAs across the country. We have 31 corporate YMCAs here in New Jersey. I said, if your doors was to close today, with the community care, because I tell you, if a community care, they'd be outside picketing with some sticks saying, keep our facility open. But if it closed down, and someone's going to walk by and say, that's a shame. So yeah, we have to get back to our roots, and our roots is community-centered work, improving the life and well-being of those that live in our community and those that walk through those front doors, and then those on the outside. Great question. Yes.
So to support innovation, you have to support risk, and with risk, there's failure. So what is your philosophy on failure? How do you support that in your organization?
Well, so my son plays baseball. And I remember I used to get upset all the time when he would strike out because he has a big bat. So when he does hit it, it goes. But sometimes he strikes out. And I said, you're striking out a lot. And then I went to a baseball coach. I said, what can be done to help my son because he tends to be striking out a lot. But when he does hit the ball, it goes. He said, do you realize that baseball is a game of failure? He said the best baseball player that hits 300, that means 7 out of 10 times they're failing. So what I say about failure is that anytime you fail, there's lessons to be learned. If you don't take risks and fail, then how you know that you're going to be able to rebound in such a way that's going to be beneficial? I work with all ladies. It's only me at the office, shh, Jackie. And we argue. But I have to listen to the other side of the argument. If not, how do I know that I'm right? So we have to embrace failure. Because I tell you what, a community will be more receptive to somebody that's willing to come in and work on their behalf and fail than whether there's somebody will stand on the outside and come in to receive some success that they did not earn. Yes. All right, DN. That's it. All righty. Thank you. Got that. All righty. Thank you.
Thanks, everyone. Just a reminder that we have our next session is coming up at 3:25. Folks who signed up for their workshops ahead of time should go to those. If not, if you didn't sign up for a workshop, then there's plenty of other panel discussions. So we'll see you soon and enjoy the rest of the afternoon.